There are three things today that we want to happen through our town hall meeting. First off, we are most interested in making sure that all the people of our community and throughout the state and of course the nation are safe. So we start here where we are with our dynamic efforts to collectively care for all of us. So what we are most desirous of now is to have on the south side of Fort Wayne a testing site for those who are in need. Secondly, we want to make sure there is in place a system where contact tracing can be taken care of for those who are affected to make sure that they're not spreading it. And the third most important thing that we'll be addressing today is just inclusion for all those who are in need for the economic reliefs that are available in our community. So we just welcome you, and we look forward to a very powerful time of working together. So we want to build consensus among all of our church, our community leaders, church leaders, our government officials as well. And we know that if we all work together, there is nothing that we cannot accomplish. So in the spirit of that unity and with the power of our faith, we go forward today to make sure that we're able to care for our community in relation to the COVID-19 pandemic. At this time, I want to recognize some of our government officials who are on the line with us right now. We have, of course, Councilman Glynn Hines, and he is county councilman at large, and also county council at large, Councilwoman Michelle Chambers. So to both of you, we thank you for being here with us. So we are going to, at this time, allow a faith reflection that will be done by Reverend Melissa Fisher and also Cedric Walker. That's Reverend Cedric Walker.
Good afternoon, everyone. I just want to say thank you for everyone who is joining in this town hall. My name is Melissa Fisher. I am the pastor of Faith United Methodist Church, and since March 22nd have been helping lead the charge for masks for the city of Fort Wayne. And the outpouring of love and connection across the city has been absolutely amazing. And I first of all want to thank God, and I want to thank each and every one of you and every single person that is not on here for donations, for help, for anything that has been to provide masks. We started this endeavor focusing and supporting Parkview, and we quickly switched our focus on helping the southeast side and vulnerable populations. So for the last month and a half, we have been producing masks for the southeast side and for vulnerable populations, and we are in need of more support. We are in need of the city's support. It is our hope, if a south side place for testing gets set up, that we could have PPE passed out to people when they receive a test. Ultimately, we know that our most vulnerable populations are going to get hit the hardest. They don't have the resources as other people have, and we are just hoping and praying that we can work together with the city and with the county and with anybody and everybody who wants to come together to provide PPE for people that are in need, so we can keep ourselves safe and we can keep others safe and we can keep our city safe and keep on loving people. I believe Pastor Cedric is taking over after me, and Pastor Cedric is also the pastor of Joshua's Temple, and he is been one of the frontline people, along with Lady Sandra Payton, Sheila Campbell, who is also on here, head of the NAACP, and many others. So Michelle Chambers dropped off ribbon the first weekend that we were making masks on my porch. So we thank her. So we just thank anybody and everybody. We have people in Ligonier, we have people in Harlan, we have people in Columbia City, Fort Wayne, South Side, East Side. We have a guy that is driving in from Convoy, Ohio, and is been volunteering and driving. So I just want to say thank you. I'm humbled. I'm humbled by God. I'm humbled by people, and I am humbled. This is something that I've never seen before. So I am not sure where Pastor Cedric is. I think Audrey is possibly getting him on the line. So I think he is next.
So Pastor Cedric is joining us. He's been somehow contained in the room for attendees, and somehow we are not finding him to allow for him to speak. So I think real quick, I'm going to ask Condra, while we're working this out with Cedric, if you can please give people a sense of the churches that are in the space, that are our congregations that are organizing with Faith in Allen County, and help them just say who they, just shout out to our congregational partners. A lot of them have already talked, but then we will be able to open up with a faith reflection.
Real quick, Dr. Davis, who's ever the host of the meeting should be able to admit people. Go drop down to participants, and it should pop up, and it should say admit whoever the host is.
I'm working on that right now behind closed doors. I'm working on that. Thank you.
All right. Okay. Well, then at this point, I would like to offer to all the various churches who may be represented. You can just identify yourself. I am a member, Condra Ridley. I'm a member of East Chestnut Street Church of Christ. And I know Destiny Life Center is a very active church dealing with faith in Indiana, or Allen County membership. Move forward.
Well, I'm Steve Kane, and I represent and come to serve with Faith United Methodist Church. Proud that we got several on here.
Paul Ricketts, Faith United Methodist Church.
Timothy Murphy, Plymouth Congregational Church.
Kate Brogan, St. Mary's Catholic Church.
Patricia Jemison, Union Baptist Church.
Step forward. Anyone who hasn't mentioned the church that you're a member of, we definitely would like for you to represent.
Hello, my name is Ana Karen Gonzalez, and I am a member of the St. Charles Borromeo Catholic Church.
Jorge Fernandez, Fellowship Missionary Church attendee.
Andre Beasley, City Church.
Okay, and Mr. Walker is now on the line. I hope that gave people a chance to get to know all of the congregational partners that are in our wheelhouse. Thank you. And we'll hand it over to you now, Prophet Walker.
Hey, everybody. Praise God, and thank you so much for allowing us to be a part of such an important movement, I guess I would call it, is because it's so important that we are holding our not just our government officials, but we as the constituents accountable to being responsible in times like these. And so I was asked on yesterday if I would give a faith reflection where this is concerned. Let me first say that I got involved with this about almost 4 weeks ago, just being out. And I noticed that there were so many people who were not wearing masks, and I had and I was watching the numbers, and I saw how many people, in the world were dying, but in particular, how many folks in underserved areas across the country where minorities are concerned, especially Black people, were dying because of this disease or because of this virus. And so we gathered a couple of people together, asked them if they would be interested in getting some masks out into the community and then some information and at least raise some awareness. That's how we ended up getting in contact with Pastor Melissa Fisher. We did a Zoom call like this on Facebook, and she noticed, and they were already doing it. And so when someone's already doing something, you may as well join in. There's no reason to try to redo it all over again. So we just brought all of our efforts and we put it behind her. And at that time, she had already, they had already put about 2,000 masks on the streets. I think now we are at about 7,000 to 8,000 masks on the streets. And our goal was 10,000. And so I'm sure we will surpass that goal. And I am seeing more people wearing masks. As I was talking with Audrey earlier today, and she was, as she was sharing her concerns with me as relates to the three issues that are on the table: one, getting a testing site in Southeast Fort Wayne; two, making some dollars available for those people who are falling between the cracks where the PPP is concerned; and then doing what we can to get those people who are not violent criminals out of that space of incarceration, so it doesn't turn into an infestation. I get it. My job as a prophet, and the prophet's job, has always been to speak truth to power. From the beginning of time, from the Old Testament to the New Testament, our job has been to remind those who are doing our biddings for us on our behalf to remember why it is that they are serving and doing what it is that they are doing, and that they are representing other people. I am like John the Baptist crying out in the wilderness, just reminding those of you who have a responsibility that there's a lot of people who are depending on you to do what we can't do. You can do what we can't do. We can pray, but we can do all the praying that we want to pray, and we can have all of the Zoom religious meetings that we want to have. But if we don't have someone in the legislative seat that will make a decision to advocate for us, to say some things on our behalf, then I'm not going to say our prayers are to no avail. But what I will say is that we probably have not been careful enough to make sure that we've had the right people in the positions to represent us. We should be able to come to you and share our concerns with you. And so as I look at the numbers from, we have faith, don't get us wrong, we have faith, but it is not a superficial kind of faith. When Jesus was up in the wilderness fasting for 40 days, the enemy came to him and tempted him in three areas. And the third area that he tempted him in was that he would, if he was the Son of God, that he would jump off of the pinnacle. And he even referred to scripture, saying that didn't the scriptures say that the angels would bear thee up, lest thou cast thy foot against a stone? And I want to remind you that Jesus did not jump. And the reason why he didn't jump was because he did not have to prove that he was the Son of God, number one. Number two, he says that it is also written that thou shalt not tempt the Lord thy God. And so we cannot, just because we're faith people, don't mean that we can just rely upon spiritual things to get us through these kinds of challenges. There are some practical measures that need to be taken place, and the only people that can get that done are those who are in legislation. We as a faith community are saying, by faith, we've chosen you. And our job is and one of the biggest challenges that the faith community have is that we are bound to obey authority, whether we agree with them or not. If we are going to be, and the question is always, if you live in a country, if you work for an employer, if you're in a marriage or some covenant relationship with someone, and then you've been asked to do something that's against your own value or what you believe is the right thing to do? When do you say no? And that's going to always be there's going to always be a lot of argument around that. Everybody's going to have their own perspective. But the one thing that I do know is that we have to be wise like Jesus was, and we cannot be foolish with our faith. And so we're asking that you help our people to be wise by raising some awareness to the need of there being, my number one concern is about there being testing in our communities. And the reason why is because it may seem that our numbers are low, but if there's no one testing, then how do we know how many people actually is carrying it? And if in every other community like ours across the country, Black people are dying at the rate that they are more than anyone else, it cannot be that it's not happening here, that we don't have as many people. I mean, logic tells us that. And so we are appealing to your values. We're appealing to your faith in humanity. And I know it can be challenging when you are an elected official, or it can be challenging when you're hired in a position, because when your livelihood is at stake, you know, sometimes we have to wonder, where are we going to land? And so I want to encourage you to land on the side of people, and that we understand that you are under a lot of stress, because we've never seen anything like this before. This is crazy. What can we do with something like this? But we're hoping that our prayers are touching your heart to not put economy first. And here's what I was sharing with people, that if the economy could save us, then we wouldn't be in the shape that we're in right now.
Amen.
If it could save us, I mean, right before the COVID, we had been experiencing the best economy that we've seen, and Lord knows when. So we had all the money we wanted. We had all the jobs we wanted. We were looking for workforce. We were trying, workforce development is everywhere, trying to get people on jobs. So the economy is thriving, which means that we can afford to pull some of those dollars that have been stockpiled and put them aside, so that we can catch some of those folk who are falling through the cracks, because you do have some people who have the kind of faith. It's not foolish, but what they are saying is, I'm not going to take a risk with my life, and I just don't want to go back to work. And my wife had to go back to work about 3 weeks ago, and we had to really sit down and think about whether or not it was the best thing for her to do. And we came to the conclusion that if her job had taken all the necessary precautions to protect her, then we could, by faith, allow her to go into the workplace. But if they hadn't done what they needed to do, then we were not going to take that chance. And so I want to encourage you all, if your family hasn't been touched, several of my families in my congregation have been touched. I've had to have conversations with people hollering and screaming on the phone because they couldn't be with their loved ones when they passed. And so this is something else, and we have to do something about it. And if we can get you to just advocate, to just think about humanity and go back to your roots of your faith and the reason why it is that you are serving in this office, I believe it's for the people, not necessarily for the notoriety of being in the office, not just to sit in the seat, but I think you're serving because you want to make life better for humanity. And so I just like to remind you that just because we are faith people, we're not leaping off of tall buildings in a single bound and waiting on God to send angels to catch us. We need to do some practical things to make sure that we are safe in our communities, and we need you to help us do that.
Thank you so much, Pastor Walker. We appreciate those words of encouragement, and we will be joining in together to help those who may not even recognize the importance of protecting themselves and trying to protect others by keeping themselves covered. So we got a lot of work to do. At this time, I would like to invite Stephen. This is your Stephen
Yes,
Kane.
my name is, thank you, Condra. My name is Steve Kane. I'm a chaplain at DuPont. Thank you, Cedric, for that word. I'm a part-time adjunct professor at a local college. I live, have family, and worship on the south side of Fort Wayne. I'm a leader with Faith in Indiana for the last 2 years. The Fort Wayne chapter of Faith in Indiana, just a little history, folks. We are one of 5 chapters in Indiana. We began work 2 years ago, canvassing and calling over 3,800 families. And through open-hearted, nonpartisan listening, we discovered the largest wound in our area is wrongful, racist over-incarceration. Women and men and children going to jail mentally ill, in need of medications, unable to make bail. With the USA having 2.1 million in jail, we know this is a generalized problem, and we're the most incarcerated country on earth. And so from these conversations and thinking together, we discern the need for pre-arrest strategies and models to serve the mentally ill and the challenged and the addicted and our immigrant populations. Talking to our authorities, and we welcome everybody that's here, we came alongside of them to share our best practices and models and dream with them. And grounded in the stories of those who are being injustice and left behind, mothers and fathers like you, grandmothers, uncles, and aunts who have children at the mercy of both the drug crisis and the systems that are often unjust. We heard the people, the voices of the undefended in our context, the working poor, our immigrant populations, and we amplified through editorial and actions, including presence in the city council, their voice. And now we have this COVID-19 absolutely horrific pandemic. All the inequities we had discovered are glaring and blaring. I am only as healthy as my neighbor. We need each other. We have to take care of everybody to take care of ourselves. And so we've done 1,400 family conversations, 140 Zoom calls in the last few weeks with authorities, reached out to 30 agencies and service providers to discover that there's really not much long-range planning on the South Side or for the South Side. We're hearing good things and we claim some of that, but we are in a food and medical facility desert in the South Side. And with COVID coming to kill people, threatening the most vulnerable, now is the time to see clearly and plan for equitable testing, equitable treatment, and tracing of this disease. Faith in Indiana is learning leaders. We are conscientized citizens called out to disrupt the status quo of racial inequity in our social services and systems. We have realized that there's shocking, shameful, and sinful lack of care for the poorest in our midst, whom we are called by all our faith traditions to serve. We are multiracial, multicultural, multi-faith, and multi-class group of leaders for a new reality in Allen County. The Xhosa tribe has a word that illustrates the best of our different religious traditions in their call for beloved community and solidarity. It's a weird word called Ubuntu. I am because you are. And I think they can call us to a new reality. We don't want to go back to the old normal. We don't want to go back to inequity. We want to go forward to the beloved community that God is calling us to, Ubuntu. Thank you for everybody being here and for this moment. And thank you for Faith in Indiana that's involved me for the last 2 years. Thank you. And now I want to pass the word on to Paula Vila, our colleague.
Thank you, Steve. My name is Paula Vila, and I'm a laboratory research specialist. I have an opportunity to possibly look into some research with some drug treatments here for COVID. I'm also president of the Hispanic Leadership Coalition of Northeast Indiana, who provides scholarships for Latino students. And I'm also a leader with Faith of Indiana. Right now at this moment, we are seeing more and more of our loved ones becoming sick and dying from COVID-19. This is not an accident. This is not beyond our control, and this is not what God wanted for us. This happens when a pandemic hits a society infected by structural racism and hyper-capitalism. We are seeing the majority of Black and Latino communities have infection rates higher than white communities. We are seeing vulnerable people, such as the undocumented people, considered as essential workers, yet have no financial support as they become infected. And because there's so much competing advice and information out there, my job is to tell you today, to help us realize what it would take to successfully save lives and eventually reopen in ways that would treat humans with dignity and respect. This moment is about uniting and leading with integrity and honesty so that no one can be treated as expendable, especially our vulnerable populations. One of the best ways we know that comes from reopening a society is by a bipartisan group of experts in every field that was brought together by Harvard University. Audrey will go ahead and post a link to this video for those of you that are interested. And at this moment, I would like to ask Heidi Beidinger, president of the board of St. Joseph's County Department of Health, to share how she and her colleagues in St. Joseph County were able to save lives. Heidi?
Hi.
Hi.
Hi, everybody. Welcome. My apologies that I'm late. I didn't get the technology. There was a little hiccup, so pardon me.
That was actually perfect timing, Heidi. Thank you.
Okay.
You're good.
Will you please share with us how St. Joseph County was able to address the COVID-19 crisis?
Yes, so, well, thank you again for inviting me to be here and have this conversation. For those of you who, I'll just a brief introduction. I'm Heidi Beidinger. I'm a faculty member at the University of Notre Dame, and I am also the board president for the St. Joe County Health Department. I was appointed by Mayor Pete Buttigieg 4 years ago. So the question of how is St. Joseph County handling the COVID response, I would say that number one, it's about communication. So St. Joe County set up Unified Command that has a phone call every single day at noon. That Unified Command is made up of our 2 health officers. We have a health officer and a deputy health officer at the St. Joe County Health Department. Mayor Mueller, the South Bend mayor, is on that call. The 2 CEOs from our hospitals, the CEO of South Bend Clinic, and a county commissioner president is on that. So that group every single day is getting briefed on the data, hospital utilization, ICU, ventilators, PPE, and testing. And then also just a general sense of what's happening in the community. There are a lot of folks, including myself in the community, who on a daily basis, we get phone calls, we get texts, we get emails saying they're upset about something, they're happy about something, whatever that is. And we're all feeding it to Unified Command. And then they're hopefully making sense of that. Every Friday afternoon, Unified Command does a press conference to let us know what the week's events have brought. We get a really good update on what's happening in St. Joe County, and as you might have heard, we are having a significant surge in positive tests among African Americans and the Hispanic population. The overall positivity rate is around 250 per 100,000, and in the Hispanic community, it has gone to 783. Per 100,000. So that's right now 3 times the rate. So, and then the death rates are matching that as well, that we're seeing an increased surge now in African American and Hispanics. So we're trying to address those things, more communication with African American communities and the Hispanic community. And we are definitely going to more, what I would say is non-traditional points of communication. Individual people who have significant networks. And that's not easy to find because those names are not just like posted in the paper or something like that. That's very relational, where I am reaching out to my network and I'm saying, here's what we're seeing. Who in the community has a network that we have not yet connected with and who needs to be in the know? And then bringing that person, those people, those networks into that communication. So that's the first thing, is this communication piece. And I'm sure, as you guys know, the misinformation that's out in the community is staggering, and it's confusing. You know, essentially, the governor has opened up our state, And that is all people need to hear. In St. Joe County over the weekend and yesterday, I was getting texts and phone calls about people running around all over the place, having lunch, no masks, walking on sidewalks, with 6, 7, 8 people all next to each other. And I think, as well-intentioned as the governor is trying to be, I suppose, because it sounded reasonable. The thing is that, people take great liberties with those directions, and they're feeling like our state is open and therefore Corona is gone. And in fact, we have not peaked yet. So the other things that we've been really working on, so communication, absolutely key. And we've got to do a better job still of doing the education for our folks. Our Sheriff Redmond for the county has been part of this process. He's not as tightly connected to Unified Command, but he's very connected to our 2 health officers. He has released 30% of the jail population let me say that I didn't say that correctly. 30% of the nonviolent offenders he has released from our jail. And knock on wood, he has not had any deaths associated with his jail. And if I'm not mistaken, he has no positives either. We are moving and increasing testing in communities of color. So Governor Holcomb is setting up 50 new test sites by the end of the week. That test site that we're getting is going into a community of color, and that makes a difference. Beacon Hospital has a mobile unit that is going out twice a week and is going to communities that have poor access to care. And so they have X amount of tests on that mobile van every single time they go out, and then it's they are open until they're out of tests. Here's a point though that I think in Indiana that we have to figure out what we want to do about the testing guideline. The criteria right now still is you have to present with symptoms. And we are told that somebody can come to one of these testing sites and say, well, I've been exposed to somebody who has coronavirus. But we're hearing also that sometimes that works and sometimes it doesn't. We're hearing that people will say, I've been in contact, and they get turned away. So in Indiana, we're not being consistent about who can actually be tested. And I'm not sure why we're not including the asymptomatics. And what I hear, the pushback I get, is they will say, well, we're following CDC guidelines. Okay, except that there's research that says there's this huge number of people who are asymptomatic, right? So if we have all of these folks that are asymptomatic and they're transmitting without knowing, why are we not more broadly testing? And so I think that we have to do way more around testing. Certainly other states are moving in that direction. Another thing for testing in Indiana is that they say that you have to have a state ID or a driver's license. Well, God bless Mayor Pete when he was here. He allowed city IDs to be issued for folks who didn't have either of those things, but particularly focusing on the undocumented folks. So in the city of South Bend, an undocumented person can present with their city ID and be able to get that test. You know that we have converted a motel into a quarantine and a hospital for, quote unquote hospital, for homeless individuals and other individuals who need a space to be quarantined because they can't quarantine at their own home. That took 2 full months to get that set up. The backlash has been tremendous. People are not happy about it. And yet there's very little disruption to the community. The community where that motel exists, the council people there are livid and actually have passed new ordinances that would make this virtually impossible to ever happen again. They said, we don't want homeless people in our town. You're bringing COVID virus right to our front door. I mean, it defies logic because, as we know, you got to be in close proximity to people, et cetera, et cetera. And the folks who are brought to the hotel are actually brought in by ambulance, van, other ways of transportation, and they stay there until they've recovered. So very, very little exposure to that community. Contact tracing is a big focus of our health department. Probably half of our nursing staff is engaged in contact tracing 7 days a week. We have flexed their schedules so that we are doing this 7 days a week. We have folks who are working in the evenings as well. It's pretty amazing. The staff themselves at the health department have really risen to the occasion. There's a camaraderie there. There's a camaraderie there that exists. It may have been there, sort of maybe under the surface, but it has definitely risen above the surface, and now we can see it. They're working together, they're cross-training each other, again, flexing schedules so that we can accommodate for families and all kinds of other things, but to make sure that that contact tracing is robust and that it continues. And then finally, I would say that
Can you speak in Spanish again?
with the
¿Me escucha, Rosy?
with the health officers.
Rosy, ¿me escucha?
I'm sorry, real quick, Heidi. I know they're trying to arrange interpretation, so I'm just going to step in real quick and say, Susanna, we can still hear you on the English side of the call.
Okay.
Okay.
Sorry about that.
That's okay. Thank you.
I just wanted to say that the final thing about the health officers. So I serve on the Board of Health, and we made some changes when our administrator, so I think the typical structure for health departments in the state of Indiana is that you have a health officer and then you have an administrator. Our board made the decision to do a health officer. We got rid of the administrator and we did a deputy health officer. So we have 2 MDs in that office. Of course, we're now in hindsight here, but it was a brilliant move. It was a brilliant move because we have these 2 people now who can back each other's play, and they're supporting each other, and they're reading everything, and they're digesting it. And these 2 are really a force to be reckoned with. So I would really encourage, if you're in contact with health departments, and they would like more insight into sort of the operations of what they're doing with our local health department, I would really encourage you to encourage your health officers to contact our health officers here. For those of you who may be serving on a board of health, our health officer has asked me and the members to be the eyes and ears on the ground and to feed that information to him with somewhat of a filter, right? Don't bring the conspiracy theories and that sort of thing, but bring the information. Because that helps him have an ear to the ground, because he's up here with the governor and the state senators and our Congress people and so forth, and he wants to be able to hear what's happening on the ground. So we're playing that role. We are also public health advocates all day, 7 days a week. And then thirdly, he wants us to continue to do the business of the board. So how do we continue to grow our health department even in this time of COVID so that we don't get totally swallowed up by this virus, that we are able to move forward? So actually I'm in the process right now of doing strategic planning. I just 2 weeks ago, sent out a survey to my board, and that's the direction that we're headed.
Thank you, Heidi. Thank you, Heidi. I'm just so thankful that you were able to advocate for your own county at the state level as well, to get some of the strategic plans and sites that you have implemented at your community. At this point, I would go ahead and like to ask Andre Beasley to address us on testing. He's from Unity Performing Arts Center.
Hello, everybody. I am Andre Beasley, Director of Programs and Education at Unity Performing Arts Foundation, home of the world-renowned Voices of Unity Youth Choir. I wanted to take some time to highlight something that we heard from Heidi. More relational communication and education with and within the communities of color was a key factor. Increasing the number of testing sites in communities of color. And also, research is saying that there's a huge number of people that are asymptomatic that aren't able to get tested. And recently, Governor Holcomb had signed a contract with an outside entity for contact tracing. But what I loved that I heard from Heidi was that they have local nurses doing that. So council members, thank you for joining us today. Thank you for taking the time to hear the voice of the people of Allen County on the issue of race, health, and COVID-19. There are various members of our staff and our leadership team here in the session today. They are very concerned about the steps that our local leaders are taking to keep them safe during the current crisis, because there's a lot of there's misinformation, there's good information, and people are very confused. We're connecting with our students each week and our families, and honestly, people are getting anxious. As Heidi said, people are living like COVID-19 it just disappeared. But luckily, this morning we heard that as a result of our lobbying and the diligent efforts of our local government, there's been a new testing site at the Public Safety Academy. We also heard that the Neighborhood Health Clinic on Paulding is offering free testing. Can Councilman Hines, can you share with us how we were able to secure the testing site at the Public Safety Academy?
To be honest with you, this is news to me. The mayor had said that he was going to announce this week his plans based on what the governor has shared, and we had shared a couple of sites that we thought would be the neighborhood clinic was one, of course. Paul Harding parking lot was one, and the Anthony Center parking lot was one. But you're saying officially, again, to make sure this is good information, that the public safety at Southtown has been designated as a testing site?
Yep, it was in the news this morning. It's going to launch next week. Councilwoman Chambers, do you have any insight on how that emerged and who helped solidify that?
No, I don't know how it emerged, but it's a conversation that we've been having with the mayor, as well as because of your efforts here. And it's just a wonderful coincidence that this town hall is taking place today, and it got announced today that there will be a testing site southeast. So there's the power of community.
Yes,
you know?
I mean, yes.
So there's the power of community.
Yes.
So it was something that we've been working on and concerned. I know this has been on Councilwoman Sharon Tucker's agenda to make sure that this happened. She has put it on Facebook. People are sharing the information. There's a link for you to go online to register it because it's going to go through the Kroger system. So everybody go online and start sharing it. It's on my page. It's on Councilwoman Tucker's page, the COVID Southeast, Pastor Walker. Make sure you get it on that. And let's get the information out there and get folks tested southeast.
Is Sheila Curry Campbell still? Is she on the in the session with us? Would she like to speak to that?
Yeah, she's on mute, but I don't know if she wants to speak.
Okay. Good afternoon. Yes, the announcement was made today. The Public Safety Academy. I believe it's 3 days a week that they'll be out there with testing. So yes, that was announced. I have it on my Facebook page also, Michelle. It's on the Board of Health. It's on their page also.
Thank you, Councilwoman. So,
and it's free, Andre. That was what we were concerned about. It's free.
Yes, it is free testing. That is awesome. So, I almost packed up and went home today, but I'm like, wait a minute. This is great, and I want to celebrate that. So everybody that's on the call, all the panelists, I do want to celebrate that advocacy, lobbying, connecting with our community officials. It really doesn't matter, so to say, like how it actually happened, but it happened. And so we're excited about that. I'm very ecstatic about that. So before I pass it on, but I wanted to touch on one other issue. So according to the Indiana State Department of Health website, there have only currently been 4,378 people that have been tested in Allen County. That's 1% of our population. And so we appreciate the step that was taken on the south side of Fort Wayne. But are you willing to continue to advocate for the long-term free testing on the south side that allows all people, regardless of whether they possess a state ID, to be tested if they are showing symptoms or if they're asymptomatic? Would any of you be willing to speak to that?
I would speak to the fact that we would absolutely support that, as we have the many years that we've served the 6th district, recognizing the fact that the underserved, not only medically, but the food desert and so many economic development opportunities are so limited that I think the COVID exposed all those holes in this ship. You know, if you consider Fort Wayne, Allen County, a ship, and there's holes that are in that ship, and we always talk about the ship going in a given direction, but every individual is like in a different part of that ship, and particularly the south side where there's medically underserved, like there is no ready-med, the food desert piece. So I think what we've got to do is continue, and that's why I'm so glad to have Sheila on the county level, and of course Sharon and Michelle on the city level, so that we can up the game as it relates to having that conversation. And we just had a conversation Saturday morning, Sharon and Michelle and I and Jeff Paddock, with the mayor regarding some of the needs southeast. So I think this is a great thing, and that's why I'm so glad to hear, and I haven't checked Facebook this morning, but I'm so glad to hear that this positive direction is being taken. And then of course, I'm gonna deviate a little bit because we're probably gonna run out of time before everybody gets a chance to speak. I'm 100% behind the prison or the jails releasing those individuals. South Bend, obviously, with the 30%. I think Fort Wayne can do the same. I don't know if it's just the sheriff and or the prosecuting attorney to get that approved, but we've got to do that in terms of getting those individuals that are incarcerated free, particularly with those minor violations that may have occurred. So obviously I'm on board with the free testing. I think that's a hell of a positive movement to occur, because I was a little concerned about, I understand the need for testing, but many of the underserved cannot afford it. So if it's free, great. And then of course the contact tracing piece, I think that's completely relevant, and is glad to hear in St. Joe County that they have a nursing or nurses that are doing that tracking, so that we can make sure that that occurs. And then finally, for me, is of course the incarcerated individuals, and then of course the funding sources, because I hear that some of the foundations are gearing their money through some of the not-for-profits, and just hopefully those not-for-profits that are receiving those funds are giving those funds to the most needy. And of course that happens in zip code 06160307.
Well, thank you, Councilman Hines, for those comments. Before I pass this on, I did want to pose one more question to any of the councilmen that feel that they want to answer. So right now we're not listed as one of the counties that the governor has identified for state-sponsored testing. Is there anyone in the local government that is working to ensure that Fort Wayne is able to take advantage of the federal and state funding that's coming down to support those who are impacted? So the question is for the council people is, are you, or do you know of anyone that is actively engaged in putting together a plan for Allen County specifically on how we can utilize those funds? Like, do we have?
I know that I'm not personally aware at this time who's actively coordinating the potential of us have a tracing site. I know that 20 sites have been identified thus far, and I find it hard to understand why Allen County was not included in that. I know there's a future announcement coming of the other contact tracing sites, and I'm hoping that Allen County will be identified as a contact tracing site as well. So we'll have to continue the conversation with the mayor and with the commissioners to see how we can make sure that happens. Unfortunately, on the governor's economic development board related to COVID things, there wasn't a representative from Fort Wayne, which is very disappointing. So we have some work that we have to do here locally to make sure that we are actively engaged in the decision-making process, that as things roll down, that it doesn't roll past Allen County. We got to make sure that we're able to take full advantage of what's happening at the state level as well as the federal level. And I'll just add to that, I'll be continuing trying to figure out how we can secure testing dollars for those who are undocumented, those who don't have money as well. We just have to get into this legislation and see where the money is and how we can serve our underserved populations through whether it's CDBG dollars, whether it's through FEMA reimbursement. It was just recently announced that cities with populations of 250,000 now can begin to apply for dollars directly. When this whole COVID thing started, we weren't eligible to go to the federal government directly because the mandate was that you had to have a population of 500,000 or more. So that's a good thing that the federal government has lowered that population status, which means we may have an opportunity to work to see if there's some dollars there for us to be able to add to testings and things of that nature.
Thank you, council people. We will be continue to mobilize more people throughout the state of Indiana. On May 21st, we'll have a town hall with Allen, Elkhart, Marion, Hamilton, Lake, and St. Joseph County. So we hope that you'll consider joining us as we try to connect with those mayors and councilmen from those cities. Thank you, council people.
Can I just add one thing on?
Yes, please do, Councilwoman.
Okay. Before the phone call, I did call the auditor because one of the things was funding to find out.
Actually, Sheila, we're gonna still have. Can I just interject real quick? I'm so sorry.
Go ahead.
I know we're running over. We had a little bit of technical difficulties. Can I ask everybody for 15 more minutes so that we can end at 1:10?
Okay. Go ahead.
Okay. And then if that's the case, we're going to go ahead and hand it over to Condra, who's going to help us walk through now these last two pieces of our bold and inclusive and caring response, which includes funding and helping release all those who are no threat from the jail. Condra, do you want to welcome us into that component now?
Okay. Are we going to give Councilwoman Campbell an opportunity to finish her statement?
Well, she's actually going to be speaking about the next.
That's right. She'll come in on this. Okay. All right. Well, according to our, faith traditions, we believe that all of us are healthy when we include all of us. And we know that we are our brother's keepers. And as people of faith, we know that it is our duty to look out for each other. And I think we are effectively showing the positive results of actually stepping up to do that. So we just know that, wherever people are coming from in our faith traditions, no matter where we're from, refugee from Burma or construction worker from Mexico, or even just the small business owner right here on our streets, we all pay taxes, and they may come from different means, but we're all in it working together. Now, because of the gaps that there are in the CARES Act, we know that not all Fort Wayne residents have been able to qualify for those federal stimulus checks and state unemployment insurance and other assistances that are available to people. And so these felony charges and misdemeanor charges, as well as lack of documentation, is shutting off a lot of people. So we want all of our people to be cared for. So at this time, that's what we want to seriously address. And we want we want everyone in our city to be able to thrive and be safe and overcome the pandemic. So we just want to take care. So right now we're going to move in, and I'd like to have a young lady, and Anna Karen McKinney, to speak for us and share her testimony.
Hello there, everyone. My name is Anna Karen Gonzalez. As I said earlier, I am, me and my family are members of the St. Charles Borromeo Catholic Church. Well, my family and I came to Fort Wayne back in 2002. So I grew up most of my life here. And I quickly learned how and why my parents were so attracted to this American dream, where we all came to believe that if you work hard, you will have what you need to care for your family. And so we did work very hard. We always have. Currently, we all had jobs in retail and service industries. My younger brother, my mom, my dad, and myself. So all four of us worked at Eddie Merlot's. It's a prime age restaurant. And during the mornings, we also had a secondhand store that we had just recently started back in February of this year. So together we all pulled together our wages to pay our utilities, our rent, our car loans, our insurance for those cars every month. So when this coronavirus pandemic hit, Eddie Merlot's shut down. We had to close down our small business that we had just started. I cannot tell you how devastated our family was and concerned of how we were going to get through this, and to see how things were just getting longer. The restaurant wouldn't seem to open any sooner. So it was definitely very hard, even for a family like ours that is used to putting, combining and our resources. But when all the income earners in our household lose their jobs all at once, it's very difficult. And so most of all, it was very hard to see how our coworkers were excited even and joking about not having to work for a couple, and because they knew they were going to receive unemployment and they were going to collect the stimulus checks that the government was giving, that none of our family members were going to be able to receive, even though we always have been paying taxes every day since we've been living in America. We were not able to gather any of that just for the fact of being born in another country. And I'm one of thousands in Fort Wayne residents in this same situation. In fact, after I got let go from Eddie Merlot's, I went to work in a manufacturing firm that was still considered an essential business, where I did work alongside with lots of immigrant people, a lot of undocumented people who were also in a similar situation. They were working for the need and, not staying at home, feeling safe of, what was going on with the coronavirus. Soon after, I began to experience headaches, a little bit of exhaustion, dizziness, pretty frequently. Then I saw how my dad was becoming sick. And, in the factory, it was a bit of a rumor that a few cases were of coronavirus inside the facility. But my family needed me to keep working to pay the rent we were already behind on. So I try not to pay attention to all those rumors, so I could get my family through this. But soon my family and I had to take my dad to the emergency room, and because he was having some respiratory problems. So he was able to get tested for the coronavirus, and he came back positive. So I began to suspect that I was the one who transmitted him the virus, because a lot of cases in my job. So I attended to the IV Tech drive-through site. I was able to get tested because I do have a state ID, because I am because of my husband. He's an American citizen, but my other family members were not able to get tested. While trying to stay separated in our homes, it became really hard because we all lived in the same household. And also we had no access to healthcare, rent, or even the utility assistance that there were programs out there in the city that they offer because of our immigrant status. So it has been definitely very hard and stressful for our whole family, with no income at all for at least 6 weeks now. So that's basically why I'm here. I heard the other day about how Los Angeles is not able to get tested free of charge, regardless of documentation status. I also heard how the mayor of Chicago has set a standard for other cities that can follow by opening up all the city offered programs to be eligible to all, regardless of if you're a refugee, you're an immigrant, or if you're a felony. So it's happening in other cities. I don't understand, why it's not happening in Fort Wayne. I know that the governor and the mayor is concerned about the well-being of everyone, and I hope it's just without exclusion in this diverse community. Our health depends on the person next to us and the person next to them. So please, I ask you to take steps and use your power to be a place of exclusive health for all. And I thank you for your time.
Thank you so much, Anna. We appreciate that. And we'd like to also give Trish Jemison an opportunity to share her personal testimony to help us in our thinking about how we're going to better take care of our people.
Hello, my name is Patricia Jemison. I am a member of Union Baptist Church. I have lived in Fort Wayne, Indiana my whole entire life. I live in 46803 area code. I, like so many other individuals here lately, I have been calling 311 trying to look for resources because of the pandemic that is going on. And when you call, you hear a recording that says that we are a city that cares about family. I come to you today because I am an African American mother who has a son that is currently incarcerated here in Allen County. He was told by his attorney that if he turned himself in on a warrant that he will be incarcerated for 30 days. We are going on 255 days of my son being incarcerated with no chance of returning back into society anytime soon with the pandemic going on and community corrections being closed and court is on again and off again. I can't go into any really details of his case because his case is pending. I'm coming to you guys, everyone today, to let you know that we have a great need of help with our judicial system here in Allen County that really needs to seek some underground attention. There are other individuals that are currently incarcerated with my son. And I do have a list of names, both males and females, that are starting to circle around that are nonviolent cases that have been denied to be released, that I am willing to share the names if needed in order to get the ball rolling with the prosecutors or with community corrections or anyone that's willing to listen in order to get these individuals released from the Allen County Jail and get them back out in society in a safe environment with their families, back working, back with their children, and being in that jail in a 6-man cell where they're not able to clean on a regular basis or be safe because of the pandemic is just not, it's not human at all. And so I'm just coming to you and asking for any help possible in return, anything that you need from me, I'm willing to help as well. Thank you.
Thank you, Trish. Thank you, Trish and Anna Karen, for your strength by sharing your testimony today, and be brave during these difficult times that we all live in. My name is Cynthia Villanueva. I'm a branch manager partner First Federal Credit Union. It's a nonprofit organization. And as we all know, there's 1,000 of our closest neighbors that we live with who have paid taxes for all these years to the city and the state, and are today without economic support due to how much the federal care package left out the community of color, refugees, and immigrants. I would like to lift up our Associate Church Executive Director, Roger Reese. He shared with us that the food assistance is always going to be open to all, regardless of documentation status. And we want to keep it that way, right? Especially in our diverse community. So we all know that we need to do more in our community than needs. So the same way Neighborhood Clinic is having this location in the Southeast that is caring and is taking care of all our community, especially those undocumented immigrants that do not have state ID and being tested. So, so counties across the state and country are stepping to fill right now gaps by dedicating dollars from county and cities to provide economic relief for those left out of this federal package. And we're talking about undocumented immigrants, seasonal self-employed workers, people paying child support and unable to collect unemployment. And I can go on with the list, but we're also focused on creating emergency housing facilities for those without shelter, especially for those that are coming out of jail and prison. We hear earlier that the Mayor of South Bend created a fund or set aside funds to allow a coronavirus isolation center, providing temporary housing for all those homeless and others. This is an urgent and immediate need, and we have to be creative in addressing it to everyone, especially for our city and council, county council. So today, as we all reunited in this meeting, we would like to ask, will you work with us to explore these solutions and work to make sure all benefits, opportunities, and services provided by the city are accessible to all residents of Indiana, regardless of birth country, current citizenship status, and were you willing to consider an economic relief funds so that everyone could be included in this COVID relief? So I would like to ask our city councilwoman, Sheila Campbell, will you work with us to explore the best strategy for those services administered by the city that can be accessible to all the residents?
I'm sorry, I was on mute. I do apologize. Well,
No
I'm
problem.
sure you probably know how the county works. We basically have oversight. And so before this phone call, I reached out to the county auditor to find out how and if we could do anything far as an emergency fund for the county and COVID for individuals that were not covered under the CARE package. And so I believe one of our commissioners are on here. I think someone said that Nelson Peters was on here. I don't know if he's still on here,
Yeah.
but yeah. And so a lot of things we county council really don't have that kind of power, but your commissioner would be someone that you might want to talk about far as county dollars. We just don't have that power. But one of the things I did want to talk about, because you did talk a little bit about funding, there is funding that came into the city of Fort Wayne that went through the United Way. And I'm sure some of you folks may know about those dollars that can be applied for as far as doing direct services with individuals. Brother Beasley did announce about the South Side, what they're doing out at the Public Safety Academy. And so far as what we are going to do about trying to create some type of fund specifically for individuals that have fallen in between that gap, I would like to give our commissioner a moment to say if there's anything that is on his radar for those individuals, because like I say, the county council has limited power. I play two roles, NAACP. So some of the things that you are talking about, the civil rights, the jail overcrowding, that's probably another conversation we'll have to have, because I know we have time restraints today, but I do want to give the commissioner opportunity to talk about dollars.
Thank you so much.
Commissioner,
Sheila.
are you still with us?
I am here, yes.
Great.
Thank you everybody, and thank you for the opportunity. There is $2.4 billion that's been funneled to the state of Indiana from the federal government. Part of it is under the auspices of the CARES Act. The first $300 million was announced last week that will be coming to the locals, basically to support additional testing and personal protective equipment requirements that employers will have as they bring employees back to work. There are more dollars coming out of additional packages in Congress that we will have to stay close attuned to. We are currently working with Kristen Marcaselli, who is the governor's appointment to the recovery team, to make sure that the voice of Allen County is in fact heard down in Indianapolis. She is from Fort Wayne, and she is one of 5 who is on that committee. It might be 7, but I think one of 5 who is on that committee. So the dollars are coming back. They are being prioritized by that group. We are reaching out based on conversations that we're hearing like this and other things that are happening in the community. But at the end of the day, how those dollars trickle down will be determined by that group of 5 or 7. The jail population in and of itself has been reduced from about 800, which was the population around March 1st, to 589 as of this morning. So the prosecutor and the sheriff are listening. There have been no identified COVID cases, to my knowledge, in the jail, and consequently, there have been no deaths that have come out. The testing that you're seeing at places like Southtown, at the Public Safety Academy, have arose from a testing program that the state had rolled out a couple of weeks ago, where they identified 20 places in the state of Indiana that were most in need of testing services. And those were the first sites that got set up. Unfortunately, Fort Wayne and Allen County were missed because they didn't feel that there was as great a need at the time. We are actually doing a pretty good job in Allen County with the number of identified cases and the number of deaths, relatively speaking. They announced another 30 testing sites towards the end of last week, and Allen County was able to gain 1 or 2 of them. The priorities for where they go are often established, in this case, through quantifiable data that the Department of Health has based on specific need. To some of the comments I heard earlier in the discussion today, the African American and Hispanic populations seem to be groups that most needed some of that testing, and many of them are located in the areas we're talking about, and consequently that Southtown, the Safety Academy area was established. As more dollars trickle down, we're going to get every penny that we can, and we're going to try and leave no stone unturned. That is about, I think, all I can contribute.
Okay, thank you. Thank you for sharing. And we know the state will eventually be able to reimburse, you know, us in a county if we step forward to help those in gap. But are we looking forward to working with you to see what we can to get the city and the county and financial relief available to all? Look into the economic relief funds, yes or not?
Well, absolutely. As I said, you know, we've been in constant contact with the city. One of the great things that's come out of this whole thing is, and we knew it before, but it's really shown through at this point, is how well collaboration works from a communications message, as well as an ability to leverage some of the dollars at the state and federal levels.
Thank you. Thank you for your response. And City Councilwoman Michelle Chambers, were you willing to work with us as well as on these economic relief funds? And that will include everyone in our community?
Of course, I'm going to do all that I can to learn and figure out how we can get, as the commissioner just indicated, additional COVID dollars. We're looking forward to another stimulus package, but I'm glad to hear that we do have representation from the city on the governor's board that will decide where those dollars go. So you absolutely have an advocate in me that we make sure that all dollars will be able to service all people here in Fort Wayne. That is an absolute goal, yes.
Thank you. Thank you for your response. City Council Glynn Hines, so what about you? Will you work with us to bring solutions and opportunity to our community needs?
Absolutely. And the one thing that I want to say is, in listening to South Bend, the communications is critical. And what I mean by that, for example, Sharon, Michelle, and I, we normally get an email from the city with an update. And I just checked my email and I had no email update on the selection of Southtown as a site. So I think it's critical that we replicate what they're doing in St. Joe County to get communications out. To that point, when services are going to be made available to anyone, irregardless, I think there needs to be a major announcement. I don't think it needs to be something under the radar where you find out, you know, like through a webinar or something. I think we need to make sure that Faith in Indiana is contacted immediately if a decision is made to fund or provide funds for everyone, regardless of status.
Thank
yes.
you.
Did you hear that? Yes.
Yes, we hear it. And thank you to all our public officials that came together today and join us in this meeting and help us to this economy relief that is very important for our community and it's a stressful time. So I will just go ahead and pass it over to the next panelist.
Oh, real quick, I think, I'm sorry, real quick. I know Sheila has something she needs to say. Go ahead, Sheila.
Sheila, I'm sorry, I forgot Sheila.
I know we are running out of time. But one of the things I want to say, like I said, I wear several hats. So on behalf of the NAACP, we need complaints. So if you have a complaint, if you have a COVID issue, please go to our naacp.org, click on coronavirus, and you will see the complaint form. So we need actual complaints. I know we're hearing a lot of conversations, some of the things that happen at Marlowe's, but we need actual complaints. And so please, sir, please, madam, share that information. You could go to our local website if you want to file a complaint here locally, but in order for us to document anything, we need complaints, written complaints. Thank you.
Thank you. Thank you, Sheila, for sharing that.
And Condra, do you want to go ahead and introduce Daylana now for the last, if everybody can stay on for a few more minutes, and we appreciate you, the last piece of our agenda, which is around setting the captives free.
All right, I will just go ahead and get started. Thanks, Cynthia. Thank you guys for staying on with us. My name again is Daylana. I am a local educator, a chairperson with the NAACP, and a faith leader with Faith in Allen County. As a community member today, I am lifting up the concern that we've already spoken about around slowing the spread of the coronavirus in our jails. How can we slow the spread and ensure all of our health by freeing our fragile and nonviolent brothers and sisters from jail? Let's look to counties like South Bend, already highlighted here, and Marion, who are leading the state in releasing of fragile inmates. In March, 25 jail inmates in Fort Wayne did receive early releases. Nothing has been reported since until today. So we are thankful for the announcement that this morning that the jail population was further released. So that is also a win for our community leaders. We do endeavor to push this initiative forward. We know that you all don't have or may not have the legislative ability, but what you do have is a seat at the table. Is it at all possible to engage prosecutors and judges around the topic of who will be good candidates for compassionate release? How can our courts be more proactive as opposed to being reactive during the present pandemic? Last, and also make actions transparent and accessible to the community, as Councilman Glynn Hines just stated. How can we move forward with those initiatives? I will ask Commissioner Peters if any of that resonated with you and if you had a comment regarding that, or ask.
Well, I can speak to a couple of them. As far as the courts and the prosecutor and the sheriff, the way their release program has worked has been, again, based on some of the quantifiable data that they have. The people that have been released are the people who are least likely to recommit the least violent offenders and those types of things. And I can't speak specifically to that because that's not the circle that I play in every day. But I do know that they are looking at the data to make that particular determination. There was one thing that you asked at the end that I've already forgotten. Can you repeat that, please?
How can we make our actions and our action plans more transparent and accessible to the community? That part?
Yeah, great question. And I do believe that, the people that we represent need to be able to see what's going on, both as the sausage is getting made and then what the final product looks like. And we strive to do that. We've had press conferences with the mayor's office every week for the last 6 weeks on various subjects, just to try and let the public know what we're doing, how we're doing it, when we're doing it. And those have been fairly successful. They've been broadcast on Wednesdays live. But the downside of everything that's going on right now is that it is happening so quickly that there's almost no time to react to some of the things that are happening, and you gotta push and pull when you can, or the opportunity gets away. So it appears maybe the transparency may be lacking, but at the end of the day, it does show itself.
All right, thank you, Commissioner Peters. We are so grateful for the conversations that we had today. So I ask our council people, would you all be willing to further explore these strategies for Allen County and consider how bringing the prosecutors and judges into a conversation about targeted release and how we could further reduce the jail population and in turn protect our community? Did any of our council people want to speak to this? Councilwoman Curry, I know that we had a great conversation with Councilwoman Michelle Chambers about this as well.
I believe my mic is open. Am I
Yes, we
open?
can hear you.
Okay. The county really plays a unique role in this. We have oversight. So oversight over dollars, not necessarily people. I think, I'm speaking as the NAACP right now, you got to start with a list. Who are we talking about? I know we have someone on the phone that has a couple of names. I do apologize. I believe it's Ms. Jemison has a couple of names. But I mean, that's, as far as the NAACP, that's where we need to start. Who are we talking about? We need to know who are we trying to get released. I think we were very specific. The young lady that gave the example with Eddie Marlowe's, what's going on with her and the CARES Act. But as far as folks being released, I mean, we need to be very specific. Who are we talking about? And that's more ammunition to go and ask for those requests. So that's my request today, is to be more specific. And who are we referring to? If there's someone that has been denied.
Thank you, Councilwoman Campbell. And we do have that list. A couple of things will be the elderly, inmates with underlying health conditions, the non-violent. We definitely have that list for you all as well. Councilwoman Michelle Chambers, did you want to speak to that before we moved on?
No, I really can't add any more than what the commissioner has actually spoke to already. There are things in motion. As a city council person, the jails don't really fall up under our mandate, but always happy to continue the collaborative efforts, always looking to be an advocate for our community when we have a concern. So I'm always here to collaborate, to learn, and to inform those who need to be aware of, we need to address some issues. But I can't restate any more than what Councilwoman Campbell has just spoken to, is to have that actionable list, so that we are well informed of what it is specifically you would like to achieve. Because the number, as the commissioner has indicated, the numbers have gone down substantially. So let's just keep that conversation going. Thank you.
Yes, thank you so much. And we are definitely encouraged by the news that the jail population has been decreased as of this morning. So that is huge. We thank you all and we look forward to you coming with us to a Tele-Town Hall on Thursday, May 21st at 7 p.m. alongside other mayors and county and city departments. Next, we will have Jorge Fernandez.
Thank you, Delana. My name is Jorge Fernandez. I've been an activist in the community for a long time, I'd say at this point. And I have family members that I have to stay in touch with that are far away, that I'm concerned with, that are in at-risk categories for COVID. So I just wanted to take the opportunity right now to talk about how we all work together to to really connect during this time where we're all so far apart. So there's some opportunities that Faith in Indiana is putting out there for those that do want to connect and stay connected over issues like this, the mobilization that needs to happen over these issues. So we're going to be launching Solidarity Circles training on Tuesday, May 12th, 5:30 p.m. To make sure that thousands of Fort Wayne residents are connected, have up-to-date information about testing, treatment, and make sure they get counted in the census and vote in the primary and general election this year. One of the keys to reducing the spread will be people, if they can, using absentee ballots. That'll reduce the need of for PPE, for probably for election, for poll workers. I think we can all agree that the more people vote by mail, I think the safer it'll be for this primary election right now. So right now you don't need an excuse. The state has made it so that you do not need a reason in order to get an absentee ballot, which is unusual because in the past you have needed specific reasons. I would encourage you to apply for that as soon as possible. You can fill it out on the internet. An application. You can call the Allen County Election Board and get an application mailed to you to fill out, to send back. But I would encourage you, because it takes time to process. You need to get the ballot and you send it back in. That you do that sooner rather than later for the primary this year. And I also encourage you to vote in the general election. We're one of 5 county chapters that will be assembling a base of affected families to direct needs to the governor on May 21st. So, trying to take some of this county level organizing and take that to the governor is also a priority. And with that, I will leave it to. One more thing. Hey, sorry. Individual responsibility. Wear your masks when you're in public. Follow CDC guidelines. We're talking about things we can do as a community, things that elected officials can do, but do your part in this. Wear your masks when you're going out places. It's most helpful when people that you may not even be symptomatic, but you may be spreading. You may have the virus and be spreading it. It's most effective when people that have it wear it. The virus and engage in proper hygiene as well, and in social distancing, which is the most foolproof. Steve, did you have something to say?
Well,
okay. Anyways, with that, I will lead to Condra written the assessment.
All right. To all of you, beloved community, know that is who you are. And I really just thank all of you. Thank God for you that we were able to assemble today. And I think we really had some great information sharing. And we have a great model in the South Bend to serve as a prototype for what we could do. I'm amazed that they have 50 testing sites and we're scrapping to get one. Fort Wayne is the second largest city in this state. We need to kick our game up about 10 notches. And I feel like we can do things when we cooperate and collaborate and bring together our needs. I feel like we have every bit of the ability to address the issues that this COVID-19 is bringing just in 2020 vision. We definitely have the ability to do the things that need to be done. And I'm appreciative of all of your time and your energies and your work. Everybody is working. And we know that when we all put our efforts together, our efforts are not just addition, it is multiplication. I feel like when we work together, our efforts and energies are multiplied. So be encouraged, continue to carry on. And one more thing, you got Sheila? Go ahead.
I just have one more thing. I just inserted into the chat, I don't know how many people can go in there, the link for the complaint form for the NAACP. If anyone has it, please, sir, please, madam, share that, and let's try to get some complaints.
Okay. I feel like by information sharing, all the things that we learned today, masks being available, and I'm so happy about the establishment of this testing site at the safety center. That's tremendous. And I know that the more we ask and the more we put emphasis on the things that we need, the more we're going to get met. We have to express and ask. We've got to ask for the things and then allow the powers that be to respond. So thank you all.
Can I ask real quick? As we're closing out, we would just like to invite all of the county and city officials that are on the call to place in the chat a big yes if you can join us, or at least check your calendar to be able to join us for that statewide town hall on Thursday, May 21st at 7 to 8:30 p.m. We will be standing alongside 4 other counties across the state. Commissioner Peters and others, you've all mentioned the importance of making sure that Allen County gets its fair share and that we lift our voices to make sure that the governor knows the importance of investing in public health at this time. So please let us know if you can join us as a next step. And then that would also be an excellent opportunity for us to be able to highlight as Allen County the steps we've taken to make sure racial equity is in our plans for COVID response.
And that's Audrey Davis with the last word. On behalf of Faith in Indiana, we thank you all. God bless your families, and may we continue to be healthy and help our brothers and sisters in our community to be safe as well. God bless you.
Thank you.
Thank you.
Thank you.
Thank you.
Thanks, everybody. We really appreciate it.
Thank you.
Thank you.
Thank you.
Thank you, Andre.